Hello everyone. In the previous post, we had asked you a question, and that was to diagnose this particular case. So let's have a look at it on DICOM. So on your screen, you can look at the DWI image of the brain, MRI brain DWI image of an elderly female. She was around 75 years old, and what we can see here is the entire right cerebral hemisphere appears to show diffusion restriction on DWI. And if we look carefully, it's actually also involving the PCA territory. So both the ACA and PCA territory and as well as MCA territory, all the three territories are involved, which means both anterior and posterior circulation is involved in this case. And along with that, there are other features which will be more clear on T2 weighted images. So if we have a look at the T2 weighted image, then this is what we can see. So looking here, it's clearly seen how there is edema in the right cerebral hemisphere, along with this hyperintensity on T2 weighted images. Along with that, there is also subfalcine herniation and midline shift, and this is all because of mass effect and edema, which tells us that because of this significant mass effect, we can say that the infarct might be around 3 to 5 days old, because that is the period when the mass effect is at peak. So this should be either an acute or an early subacute infarct. Now if we look here as well, the PCA territory also shows hyperintensity and edema. So both the ICA and the posterior circulation, both circulations have been involved. But more than that, what is more important here is, if we look here, then what we see is, look at the ICA on either side. If you look carefully, the left ICA shows a proper signal void, which is basically the flow void of blood vessels. But if we look at the right sided ICA, then we can see that it's hyper intense and there is no signal void. So loss of signal void in this vessel tells us that there is some sort of thrombus or obstruction that is causing obstruction of flow into the ICA, and therefore there is infarct in the region that is supplied by the ICA. However, since the PCA territory also appears to have been involved, if we also look above at the level of the centrum semialveolar and in the high region, then we can clearly see that the PCA territory is also involved, and that tells us that there is a possibility that the patient might be having a fetal PC or a fetal PCOM, because of which this is happening. In the next post, we will clearly tell you about what this fetal PCOM or PCA is and how it leads to infarct even in the posterior circulation territory when the thrombus is actually in the ICA. So till then, stay tuned. And secondly, now we'll go and see who are the ones who gave the correct answer to the question. On Facebook, we can see a number of answers, and though most of the people have correctly identified the right-sided cerebral infarction and the ICA thrombosis, the more accurate answer has been given by Atif Al. Atif Al has specifically mentioned that there is a massive right ICA infarct and PCA territory involvement could be due to fetal origin, and yes, that is a possibility. Unfortunately, we haven't been able to get MR angio for this patient done, but as soon as that happens, we'll let you know about it. And so rest all the findings has been mentioned by almost everyone. The loss of flow void and the diffusion restriction in the right cerebral hemisphere. But yes, this also has to be at least suspected that there is a possibility of a fetal origin. So on Instagram as well, on our Insta page, we can see the comments here. So yes, everyone has mentioned about ICA occlusion and about the edema and the infarction on the right side. And yes, but the best answer would be if you also start suspecting about a fetal PCOM and get an angio done for it. So that's the end of the video, and stay tuned for more such cases and keep following Radiance.